We're ready to admit.
Yeah, let's go ahead and get started. Good morning. Welcome, friends. As we're awaiting more folks to join from the waiting room for the Vitalyst Health Foundation System Change Grant Information session, we'll get started in just a moment. Feel free to introduce yourself in the chat room if you'd like. Your name, your organization, your preferred gendered pronouns, where you're calling in from today. We will get started in just a minute. Awesome. Good morning, everybody. Great to see familiar faces, a lot of new faces as well. We'll get started with the Vitalyst Health Foundation Systems Change Grant information session in just a second. Welcome. Well, good morning, everybody. My name is David Martinez. I am the Director of Grants and Civic Health at Vitalyst Health Foundation. Welcome to this fiscal year systems change grant information session. We're in Vitalyst fiscal year FY 25-26. We are reviewing the systems change grants for Vitalyst Health Foundation over the next couple hours. But before we get started, I'll toss it over to my colleague, Sergio.
Hi, everyone. My name is Sergio Perez. I'm the Director of Strategic Communications here at Vitalyst. Pero esta parte es en español. Yo me llamo Sergio París, soy el Director de Comunicaciones en Vitalyst Health Foundation. Pero para todos los que necesiten ayuda en español, tenemos un email, conversemos@vitalysthealth.org. Y ahí nos pueden mandar cualquier pregunta que tengan en español, ya sea sobre el grant o cualquier otra pregunta que tengan sobre nuestros apoyos para las organizaciones. Entonces, cualquier pregunta que tengan, escríbanos ahí.
Great. Thank you so much. Thank you so much, Sergio. In addition to that accessibility measure, we have closed captioning available. All lines should be muted upon entering the webinar, but definitely use the chat room, the Zoom room throughout the webinar to post your questions as they arise. Our team will be on hand to answer those as they can. In response, we will also have a live Q&A at the end, near the end of the webinar to answer additional questions. We will also be capturing all of those questions, both in the Zoom room and those that are captured live to compile a frequently asked questions document later. That addition, along with the slides and a recording of this webinar will be posted to the vitalysthealth.org grants webpage, so you can access those later. As I mentioned, we have a few of our team members on the call today. This is the Vitalyst Grants and Partnership team that I have the great pleasure of directing. You'll see my colleague, Michelle Goodthunder, who many of you may have interacted with, who's done an amazing job helping us set up a new grants management system that I'll talk a little bit more about later on when we get to the logistical pieces of submitting a system change grant application. And Erica Foster is newer on our team. She manages our learning and evaluation. We have other team members that are really critical that I'll have the opportunity to introduce you to later. If you're not familiar with Vitalyst Health Foundation, we have a strong vision that all individuals and communities in Arizona are healthy and resilient. And in order to see that vision come to reality, we are on a mission to connect, support, and inform efforts that improve the health of individuals and communities in Arizona. While we're based in Phoenix, we have partnerships around the great state of Arizona. And while we are a health foundation, we see health as more than just health care. We look at the broader social determinants of health, or the broader social indicators of health, or what we call the elements of a healthy community. Many around Arizona may have seen the WIL, as we affectionately call it, that showcases a wide variety of indicators that impact a person's ability to live a healthy life for themselves and in their communities. This WIL is what we use as a measure of mission alignment for Vitalyst Health Foundation, especially the intersectionality of all of these things. We see health in all policies and everything, and of course have a strong values around health equity and resiliency. So if you're beginning to ask yourself questions around mission alignment, and if this potential partnership with Vitalyst Health Foundation aligns with your efforts, use the WIL to guide that. And we'll talk a little bit more about the WIL as we get to the specific grant criteria for the systems change grants. Vitalyst Health Foundation operates like most foundations. We have a responsive grant-making program. It is really unique, though, in that it is framed to support coalitions or collaboratives working to implement some sort of systems change. So we have set up our grants program to be a 5-year grant potential for partners to receive up to $225,000. That first tier grant is our technical assistance grant, which is meant for capacity building needs of coalitions who want to work towards systems change. Then the second tier is our Spark grant, which is a 1-year planning grant for coalitions that have been built, but just provide them some time to plan towards their systems change. And then the systems change grant, which is our 3-year grant to help those coalitions that have been built, planned, and are ready to implement their systems change efforts. Today, we will primarily focus on the systems change grant, but I will have a slide near the end that highlights at a really top level our technical assistance grants and Spark grants. But as we go along this webinar and as you discover partnership with us, you may see that your efforts are earlier in their journey towards systems change, so you might be more aligned with a technical assistance grant or a Spark grant. So we will have those follow-up conversations and get you connected with those opportunities as they arise. But today we're going to focus on our systems change grants. All of our grant partnership opportunities are available for any Arizona group to explore. We have created an initial discovery process, a quick intake form with some brief eligibility questions so that we can begin to track the relationships in a strategic and resourceful way through what we call our discovery process. Again, it is a quick intake form that prospective partners can complete. And once submitted, we review that initial form and then get you connected as it fits with one of our directors at Vitalyst Health Foundation to have a deeper conversation, an initial consultation call that is set up via Zoom to be out virtually to have that deeper conversation. And depending on what your effort is towards systems change or what your coalition project is focused on, that topic depends on who you talk with at Vitalyst Health Foundation. We each have different portfolio areas, backgrounds, and subject matter expertise in different elements of a healthy community. So we have set up a kind of routing system where once a discovery intake form comes in, it is sent to the appropriate director who can come into that conversation with a little bit more know-how in the specific topic that you are covering. So for instance, my colleague Gabriel Jaramillo is our Director of Healthy Communities. His portfolio includes housing, aspects of multimodal transportation options, a lot of local zoning and policy ordinances, and things of that nature. I am our Director of Strategic Community Partnerships. So I'm kind of a catch-all, but especially collaborate with organizations that work in the field of civic health, as we call it, civic engagement, civic participation, and the broader aspects of the elements of a healthy community. My colleague Sergio Paris, who you briefly heard from earlier, is our Director of Strategic Communications. He has a strong background as a forever food banker, so in food systems and in the educational system as well. So those conversations will be facilitated by him. And then my colleague Anna Rossetti, who I believe is joining us today as well, oversees our healthcare integration portfolio. She's our Director of State Health Policy and Advocacy. So most things healthcare related are conversations that she facilitates, including conversations around workforce development, Medicaid, our state Medicaid system in Arizona access, including some provisions around Medicaid reimbursement. No matter what, once we receive your discovery intake form and review it, you'll be sent an email to schedule a time to chat with one of these directors to have that initial consultation call. If your discovery intake form seems still pretty broad and just needing a little bit more information, we might first direct you to our monthly virtual 101 webinar series, which again we host monthly, and I provide general insights into Vitalyst, how we operate both our grant making program as well as our more priority-based portfolios around healthcare integration, civic health, and housing. So we might direct you to that resource if it's a fit. So let's dig now into our Vitalyst Health Foundation grants program. As I mentioned, it's set up as a 3-tiered grants program, recognizing that systems change is heavy work. It takes a village, so there's a really strong focus on coalitions, and it takes a long time if you have worked in the system change space. So we have set up this 5-year grant potential, starting with the up to 1-year grant of the technical assistance grant, the 1-year grant for the Spark grant, and then the 3-year systems change grant. As I mentioned this morning, I'll be spending about an hour or so taking a deeper dive into the systems change grant only, since that is the grant cycle. Well, all of our grant cycles are now open, but that whose deadline is coming up here pretty soon. We, of course, through our discovery calls, can continue to have those conversations around the technical assistance grant and the Spark grant, but today we'll be primarily focused on the systems change grant. As I mentioned, we'll have about an hour or so where I'll provide a deeper context and better understanding of our criteria for the systems change grant. We'll spend about 30 or so minutes talking about the logistical aspects of grant submissions and about 30 minutes held for Q&A. And again, these slide decks, this recording, and all of the questions asked in the Zoom room, which is open for questions now, and during the live Q&A session near the end of this webinar, will be posted to the vitalysthealth.org grants webpage and also shared in an email with all the registrants. So here is the timeline for the systems change grant this fiscal year. It is already September 9th, and we are opening our online portal for submissions today to kick off with this information session. The discovery process is open as well. So if you go again to vitalysthealth.org and our grants and partnership page, the discovery intake process is open. So if you see alignment with Vitalyst and our grants efforts, you can complete that discovery intake form. And then once we review it and see alignment, may have a conversation with a director as a follow-up. If it's determined that the systems change grant is the grant that you are most aligned with, you have until October 9th to submit your application. And that is a Thursday by 5 p.m. Mountain Standard Time, Arizona. So submission deadline this year is by October 9th. But the online portal is open now, so you can we'll review instructions on how to log into that portal and begin working on your application. Once the deadline passes, we go into our review period. There's a small team of Vitalysts that I lead that reads all of the submissions and does an initial review of baseline qualifications and eligibility to ensure that those that advance meet the basic eligibility requirements of our grants program. And then we put those that advance into our own online portal for our team to begin reviewing. Our grant review team at Vitalyst House Foundation is made up of some of the team members at Vitalyst and a grants committee of our board of trustees. So there's a good amount of folks that are reviewing the applications in our review portal and using an evaluation rubric that we have created new this year that I will be reviewing as part of our grant criteria. Once the team does their reviews and submits their scores, we compile that data and the team reviews and decides which to advance and invite to present their proposals. And that will happen by November 21st. So in this instance, our grants application process is a two-step dance. First, the submission of a written application, and then semifinalists are invited to apply, or excuse me, invited to present that same proposal in a 30-minute virtual presentation to our grant review team at Vitalyst. Those are by invitation only for presentation, and those that the team decides not to advance will begin to receive declination notifications or notifications that their proposal did not advance. So you should be hearing one way or another if you advance in our process by November 21st. Those that are advancing and being invited to submit or to present are provided an opportunity to get feedback based on the reviews of their written application. This is especially a time for Vitalyst team to reflect any questions that were posed during that written application review so that your collaborative can ensure that those questions are addressed during your presentation. Then each coalition will select a time the week of January 12th to 16 to present their proposals. We typically do these virtually to ensure accessibility since we do have grant partnerships throughout the state of Arizona for about 30 minutes, including a Q&A with the grant review team and the collaborative partners that are presenting. Once we finalize all of the presentations, the grant review team of Vitalyst does a second round of reviews using our evaluation rubric to review just the proposal aspect of the application. And then once all of those review scores have been submitted, our team looks at both the written application scores and the proposal scores of our grant review team, compiles that data, and ultimately selects the 4 that we recommend to our board for funding. It is a very competitive grants process because you did hear that correctly. We have funding for up to 4 systems change grant partners this year. These grants do have to be reviewed and approved by our board, and we have a grant committee of our board that meets March 5th to hear the staff recommendation and consider advancing that recommendation to the full board of Vitalyst, which will be on March 26th. And once they ratify that recommendation, we will make award notifications on March 27th. Over the past several years, we've done our best to streamline this timeline and application process to practice principles of trust-based philanthropy, including making the application as equitable and accessible to partners on the wide spectrum of infrastructure and capacity. We do work with a lot of grassroots community-based organizations. So the two-step dance, that is our application, that includes both written application and a presentation, may seem like an added step or an added barrier, but a lot of the partners and collaboratives that we work with don't have full-time fundraisers or development office staff, or even a contract grant writer. So their written application may not be the best, but they sure can tell their story. So the presentation provides them a great opportunity, a bit more equitable opportunity to present their proposal. And we have simplified the written application proposal itself. For those that have been with Vitalyst for some time, you might remember the day when we had an initial letter of intent submission of 2 pages, and then after a review of those, semifinalists were invited to apply to submit a 6-page written application. Based on feedback from partners, it was decided to just collapse that written application to 1-step submission and choose kind of a middle of the road page submission, which will be about 4 to 5 pages this year. So now that we reviewed the grants timeline, let's begin to reflect on the system change grants criteria. If, again, for those folks that are familiar with Vitalyst House Foundation, these grant criteria should not look different because they are the same 5 criteria that we've had for quite some time. But based on a lot of feedback from past applicants, those that advanced and were successful, and also those that were not advanced for funding, gave feedback on how Vitalyst Health Foundation can better help folks understand what our specific grant criteria are and help us understand what exactly is systems change, what makes a strong collaborative, what are specific health outcomes we should be focusing on, how do you assess health equity, and how can we ensure that the narrative of our budget really reflects those key aspects that you're looking for in a grant application. So we have revised and improved the wording of each of our grant criteria to hopefully help you better understand what exactly we're looking for in our grant review process and our grant applications, and also to help you better understand, just as a thought partner and leader in the ecosystem here in Arizona, to really address the root causes of the greatest health disparities in Arizona. That, of course, is through a systems change lens, which, as I mentioned, is heavy work and takes a strong collaborative of folks to help advance and ensure great success on that front. So we have 5 system change grants criteria. The first being that the effort actually has to be a systems change. So in your 4 to 5 page proposal, you have the opportunity to reflect on what your project design is that is helping you achieve that systems change. In this narrative, you should be really clear with what your problem is, what the system that you're focused on, the barriers and goals that are keeping, or the barriers that are keeping that system in place that is making it more challenging to improve health conditions, and what your overall goals are. We will reflect a little bit later about the specific systems change conditions to help you better frame and see what systems change is. And this is where you outline the timing and anticipated challenges of your systems change effort. As you see, there is a weighted score to our criteria. The systems change piece in this application is worth 40 points. It is a big piece of our systems change grants criteria. They are called systems change grants for a reason. We really need the effort to be focused on a systems approach, and not a bit more programmatic or direct service effort. We'll go deeper into that in just a moment. As I mentioned, system change is heavy work, so it takes a village. So we still have a criteria around the effort needing to be a collaborative approach. This can also be called coalitions work. But in this instance, depending on what the systems change you're hoping to achieve, you should look at if you have the right core partners as part of your collaborative that can help ensure the success of that systems change. The collaborative at this point of the systems change grant should not be new. The capacity of that coalition should be built. The planning for the coalition should have been completed. You are now ready to implement your systems change effort with your collaborative. So ensuring that the roles and responsibilities of your collaborative are clarified in your proposal is really important, showcasing then the history that you have in organization and the alignment you have as partners. Because if you've worked in collaborative work and coalition work, it's hard. Coalition work is hard because you're coming together for a common goal, a common purpose, even though you each are maybe individual organizations to working on your own individual projects outside of that coalition. An important aspect of the collaborative and systems change is how you center community voice. Your collaborative should include those closest to the problem as closest to the solution. So there is a specific question and review criteria around how you are engaging those with community lived experiences that are directly impacted by the health outcome that you're hoping to achieve. And then we often are question whether the collaborative that is submitting the grant application is best positioned to implement the actual systems change. So you'll have the opportunity to reflect on that as you write up your collaborative about your collaborative in the application. We are a health foundation, and the systems change grants are working to improve health. So our health outcomes criteria is now more broadly framed around that broader elements of a healthy community to ensure folks see the mission alignment with Vitalyst and our approach with the broader social determinants or social indicators of health and the intersectionality of all of those different elements. So we will again refer to the wheel for you to help frame the elements of a healthy community outcomes you're hoping to achieve with your systems change grant and the alignment with those and how your collaborative will track the improvements with specific metrics to ensure that the health outcomes that you're hoping to achieve through the systems change effort is achieved. Health equity and equity just in general is a really strong value of Vitalyst Health Foundation, and it's reflected in all of our work, including our grants program. So much so that we have a criteria to ensure that our grant partnerships have that lens as well. So this is how you are using disaggregated data to as part of your effort to improve your specific health outcomes and demonstrate the involvement of, again, those community members with lived experiences in the health outcome you're hoping to achieve. And then last but not least, the fifth criteria of our grants program is the budget. So the budget is a narrative of your budget is to be included in your written proposal in addition to the submission of a template spreadsheet that will have to note the 3-year expenses for your systems change efforts. The narrative is a great opportunity for you to tell the story of that budget spreadsheet and clarify how the funds will be used and how the proposed scope of work aligns and matches with the budget request. We especially look out for equity practices within the budget as well, including who your subcontractors or sub-grant partners or compensated community members are in as they're reflected in the narrative and in your budget. And then what the overall capacity of your collaborative is to tackle the systems change grant, because as I mentioned, it's heavy work. It takes a lot of people, a lot of partners, a lot of years, and often a lot more funding than what the Vitalyst systems change grants, Spark grants, and technical assistance grants can help leverage. We also really want you to be successful in your systems change grants. So in the budget, ask what your anticipated total cost of the project, not just what the grant funding of $175,000 over 3 years will cover. So we can begin to see what the funding gap you have towards your project, and maybe connect you with other resources that can help you and align funding or pull funding in that sense. So that's a really high level overview of our 5 systems change grant criteria. Now I'll go a deeper dive into each one of those criteria. So the system change grant, the system change criteria of the grant, and what you're seeing on this slide are the 5 questions that you are to answer as part of your written application. Our president and CEO often said that our grant application process should be like an open book test. The applicant should know exactly what questions and what answers we're anticipating as part of our grant applications. So you'll see in this slide that takes a deeper dive into the systems change criteria of the grant. The first question is, what is the system and the problem you're trying to solve within that system? Once you log into the online portal, if you determine that the systems change grant is most aligned with your effort, you will have a specific field to write that answer. The wording that's below that question is what we gauge as the strongest possible answer for you to score the highest for that question. So we want to ensure that the work is being done at a systems level, that the problem you're trying to address are systemic, and that the barriers holding the problem in place within that system are clearly defined. If your section for systems change clarifies that to the best of your ability, the stronger your application will be and the higher score you will have for the systems change criteria. The second question, what is the goal of your systems change effort? What does success look like if you achieve your systems change goal? This goes from the system more to what your systems change is. So what is the root cause of the problem, and does your written application clearly address that for systemic change and permanent impact? This really begins to get to the question of, is your effort actually a systems change or not? The third question is, which of the 6 conditions of systems change is your project trying to address, and what are the specific strategies for your planned intervention? We use a framing around the conditions of systems change that you'll see a visual for in just a little bit. It's over the past year, based on a lot of feedback, we again have done our really diligent work, both internally and for external thought leadership and partnership, to help folks better understand what we mean by systems change. And these conditions of systems change is a great framework we have adopted to help folks better understand what it is. So in your proposal, you should reflect on which conditions your systems change effort is framed under and as it aligns with the systems change, and then begin to take a deeper dive into what your specific strategies or interventions or solutions are to implement your systems change. Especially when you were reflecting on the best practices within each of those conditions, and if you're actually addressing the root cause of the problem. The fourth question that you'll answer for the systems change criteria is, why is this the right time to implement this systems change? We measure the likelihood of success for this effort and that it's really clear and defined, and that the potential for success is strong. We know, especially in today's day and age, there's a lot of change, there's a lot of wind shifts, change happens within systems change efforts, But at the end of the day, we want to ensure that those grant partnerships we have are best positioned for this moment to achieve your systems change efforts. And then the last fifth question of the systems change grant criteria is of the systems change criteria for the grant is what obstacles do you anticipate in achieving your systems change goals, and how might you work around those obstacles? Again, this reflects on the concept that change happens within systems change efforts, and a strong collaborative working to implement systems change has kind of this feedback loop to be able to address those changes that are happening, learn from them, and pivot in strategic ways to continue their system change efforts towards strong advancements or success. So again, these are the 5 questions that you are to answer in your written proposal for to cover the systems change criteria of our grant. So what exactly is systems change? As I mentioned, Vitalyst staff working with national and local partners have worked over the past year to launch what we call our systems change series to help folks better understand systems change. My colleague Sergio, who we introduced earlier, has been working really hard with our PR team to promote a better understanding of systems change in a lot of different ways, including the publication of a Spark report that we drafted with our partners at FSG, a national thought leader in systems thinking and systems change. So at vitalysthealth.org on our publications tab, you can see this report and read more about what we mean as systems change and help folks understand it. I will cover broadly aspects of the trainings that we've done over the past year and more around system thinking and systems change. But again, if you go to vitalysthealth.org, we have a whole webpage dedicated to helping folks understand systems change, which includes this publication, additional webinars and workshops that we've collaborated on with a variety of partners, podcast and blog posts and videos of previous Vitalyst grant partners to better to showcase successful and strong advancements in systems change efforts. So you begin to see and frame what we have supported in the past and have seen as systems change. But as just a quick education around system thinking and systems change, a system is where we start with understanding systems change. There are many types of systems that operate around our ecosystem. But in general, a system is a set of interconnected, interdependent, and interacting parts that form a complex, unified whole. This system could look like a lot of different things. As I mentioned, the solar system is a system, right? All the constellations, the planets, the sun, working together in a really crazy way. A bicycle could be seen as a system because you need the different aspects of a bike to operate in order for it to go. So it could be at both a small micro or macro system levels. The systems that we interact with on a daily basis, especially with in the health space, are often made or built or end up in a way that ensures that or limits our ability to live healthy lives. So that's where the concept of systems change begins to come up so that we can shift those conditions that are holding the problem in place. That's what we're really trying to tackle with our systems change grants efforts. So to help folks see a bit more clearly what exactly systems change is, our partners at FSG have created this this framework, the 6 conditions of systems change, the inverted pyramid that you see on your slide. It's not new to how Vitalyst has framed our systems change grants program. So these are the different conditions that collectively lead to transformative systems change. Systems change, as I mentioned, is really heavy work. And in many instances, it's a long game, it's a marathon. And comprehensive systems change efforts do include all six conditions. But in many instances, the small baby steps, including those that can be achieved with our grants partnership, may tackle just one or a couple of these conditions. So do not feel that you have to address all six conditions of the systems change with our 3-year grant, system change grant, or the 5-year grant potential in total. Your effort at this moment might simply be tackling the condition of policy as the systems change, or of power dynamics as a condition of systems change. But we use this framework to show just the different types of systems change efforts that are considered ones that we would support and have supported in the past. To provide even a bit more guidance to this to help guide what are or could be considered within each of those conditions, here is how it is represented in a different way. This especially showcases that the inverted pyramid is in different tiers. So you have the structural change, which is that top tier, the policy, practices, and resource flow conditions. Those are what are called structural changes, where I like to say it's just a bit easier to see. They are a bit more tangible of a systems change condition because you can actually say, I am trying to change this policy, House Resolution 1, right? That's a real tangible condition. Or a practice change that might need to happen at a state agency or a city department or an internal health plan that would really change that organization and the practitioner's activities a bit. But that practice is usually a tangible practice, an ordinance or a rule change. Resource flow is another one where it's actual tangible. Certainly the financial aspect of it, but the people power, the knowledge power that comes with the resource flow conditions, how information is shared as well. So those are the more visible conditions of systems change, the ones that are a lot easier to define. It's once you get to that mid relational change tier and certainly that lower transformative change tier where the systems change is so much more difficult to see and to define. And this is where Vitalyst in the past has seen the greatest difficulty for folks to better understand if their effort falls within these conditions, if their effort is actually systems change, and ultimately be successful in securing a grant from Vitalyst. So in this relational mid-tier, relationships and connections, these are really hard to measure and define, right? How do you measure trust of a coalition or trust between partners working in the same system or toward systems change? The same thing can be said of power dynamics, right? We know that they exist, but in this case, especially, I really note that there's like a shift in power that happens between individuals and organizations that are ultimately the ones that are holding the problem, the barrier in place that would improve the overall system. And then the most transformative type of systems change is when we're changing hearts and minds. The mental model condition is shifted, deeply held beliefs and assumptions that influence one's actions are changed. That is a monumental transformative condition of systems change where you really begin to see that the system is changed overall. But that often comes after several years of push. When we're talking about systems change, you might often hear in the public health field, especially, that a systems change effort is an upstream intervention as opposed to a downstream intervention. So in this visual, it represents that upstream and downstream. You could see the blue water representing the stream. and then broken up into the middle tiers by that dotted line that looks at different strategies, the community versus individual impact, and the tactics that are considered upstream, midstream, and downstream. So a systems change effort is focused on that upstream approach rather than that downstream approach. The perfect example I give of this all the time, because both Sergio and I used to work in food banking, are food banks, right? And each food bank operates a little bit differently, but just in general, food banks distribute emergency food boxes to those that are experiencing hunger today. Very, very important work, but that effort is seen as a more downstream effort. It still needs to happen because people are experiencing hunger today, right? But what we're really trying to tackle is while that downstream intervention is happening, what is an upstream approach that we can take and support through our System Change Grants program that is really exploring what is the root cause of that hunger in the first place? Why are people having to go to the food bank in the first place? Those are the questions, the solutions that we really are trying to support with the Vitalyst Health Foundation grants program, including the Systems Change grants. So you can see some of those tactics definitely correlate over again to those conditions, laws, policies, regulations. Those again are really highlighted as the explicit conditions. But again, just another visual representation for you to hopefully better understand what we see as systems change. As I mentioned, there's downstream, midstream, and upstream interventions. All of those interventions are really, really important. As I mentioned with the food bank example, people are going hungry today. They need the food bank, they need that emergency food access. But at the same time, Vitalyst is really hoping to encourage and influence our ecosystem to take more upstream interventions. And we know it's challenging to do that because it's heavy work. It often takes collaboratives, which means you have to build trust and relationships with other partners that are aligned with you in that space. And nowadays, right, so many of our nonprofit friends are just trying to keep their doors open. A lot of federal funds have been cut. We completely understand the challenges that are happening in our world today and in our sector. At the same time, we know that we are still focused on this long-term approach to addressing the root causes of the greatest health disparities in Arizona through systems change, which is why we really are still focused on not only our system change grants efforts, but also just uh, 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 adding to the discussion around systems thinking and systems change opportunities, even in today's day and age. It is heavy work, but hopefully these two columns showcase what we often see as system change efforts, the different components of systems change, and then what efforts do not include systems change. And I'm going to focus on the right column for those efforts that do not include systems change. This includes addressing only the symptoms of social challenges. Again, these are the more downstream or even in some instances midstream interventions. For instance, distributing food boxes or just subsidizing healthcare costs. Those are addressing the symptoms of the social challenges, not the root cause of the challenge. The delivery of programs is also not systems change. This might, um, uh, especially if your application is focused on a programmatic effort that needs ongoing support and funding, that likely is not a systems change because it is more programmatic in nature, more direct service in nature. And as I mentioned, systems change is hard. We're really looking at the outcomes of improving health. Um, the system that's a systems change. A more programmatic or direct service downstream intervention is more focused on outputs, like the amount of food boxes distributed, rather than the amount of people not having to come to the food bank in the first place. And then just some final reflections on the systems change criteria. If you're thinking, I'm still not quite sure if my effort is systems change or not, it's okay. It's hard to understand. We totally get it. That's why we have so many different resources and a whole webpage dedicated to helping you better understand systems change at vitalysthealth.org, begin to ask yourself, okay, what is going on in the system that I'm seeking to shift? First of all, think about the system that you're working and the problems that exist with that system that is making your work that much more difficult, or really the barriers to improving health. And then take a step lower and think, okay, what are those conditions that are really holding that problem in place that I might want to tackle? Then you begin to really think about the systems change potential. And then the different strategies to help that systems change efforts really begin to allow you to focus in on, okay, what are those specific policies or practices, the resource flows, the relationships and power dynamics that need to be changed, the mental models that have to change, and the strategies that I deploy for those, are they actually systems change, or are they more programmatic, direct service, or downstream approaches? And once again, we have a plethora of resources to help you better see systems change efforts. These are the 4 new systems change grant partners that Vitalyst has. And we've even done a lot of work as we have rolled out these announcements and have framed those announcements to better clarify how we have seen the systems change in each of the grant partnerships, but also all the other grant criteria. So again, if you go to the news webpage of vitalysthealth.org, you'll see blog posts and videos for each one of the 4 systems change grant partners that we introduced as our new class. To help you see what has been considered successful systems change proposals in the past. You even see on this slide, we are even helping frame what their project is towards systems change, rather than just say putting up the lead applicant's organization. First of all, it's a coalition, a collaborative effort. So even just putting the lead applicant is already a wrong framing. And how can we better highlight what the actual systems change effort is? So definitely check those out. They're about 6 to 8 minutes each, and provide great insights, and also just showcase some pretty amazing things happening throughout the state. Okay. I know that was a lot, but we really wanted to stress the systems change criteria of the Vitalyst Systems Change Grant and how important it is to our grant effort. Again, it's worth 40 out of 100 points for your written application. So a big aspect of it, and an initiative that we're really trying to lean into so that we could get higher quality applications that are actually systems change. But there are 4 other grants criteria that I still have to review as we get to the top,
These people are idiots, dude.
the top of the first hour of our systems change grant program here, of our system change grant information session. So the second grant criteria is the collaborative. Not only does your work have to be framed as systems change and actual systems change, but the work to implement your systems change effort should be done in coalition and in collaborative. Again, these questions, open book test, these are the same questions that are asked of you, and the wording below each question are the answers that our grant reviewers will consider the strongest application. The collaborative piece is assessed in 2 ways. First of all, you will have the opportunity in your written application to provide a narrative of your collaborative and answer these 4 questions to the best of your ability. And again, the closest you can get to those answers that would reflect the strongest potential collaborative for each of the questions, the stronger your application will be. In the online portal, you will also have the opportunity to upload letters of commitment from your core partners as part of your collaborative to not only continue to highlight each of these 4 questions, but to specifically note their roles and responsibilities that are helping you achieve your systems change grant. We are really intentional with using the framing of letters of commitment as opposed to letters of support, because letters of support are mostly like endorsement letters, like, we support your effort, go get them, Tiger. Whereas a letter of commitment is, this is my specific role in this collaborative to help us achieve this systems change. I'm aligned with this partner. We've been working together for quite some time. We have built trust and relationships. We understand what every core partner is doing as part of our collaborative to help us collectively achieve our systems change. So your letters of commitment should be from your core collaborative partners to highlight their specific role and responsibility. We highlight this especially because many of your core collaborative partners may be more institutional partners, and getting letters of commitment might have to go through several chains of command and approval, especially when you're talking about government partners, university or college partners, or other more institutional folks where their letters of commitment towards grant applications have to be vetted, reviewed, and approved. This includes tribal partners and tribal government entities who might even have a heightened review and approval process. So the sooner that you can get these requests in, the sooner you can get all of your materials together and submitted by the October 9th deadline. So for this collaborative, criteria, there are 4 questions. The first, what are the organizations involved in this collaboration, and what is the role each has that contributes to the shared change, systems change vision? How is this also clarified in the letters of commitment? Again, you reflect on this question as part of your written application, but then also ensure that it is answered within your letters of commitment. The collaboratives in this instance should be Arizona serving with at least 3 partners whose roles are clearly and strongly defined. We struggled with helping folks understand how many partners is considered a collaborative or coalition. And we ultimately settled on at least 3 because systems change work is heavy work. It takes a village, it takes a collaborative and coalition. But what we're really looking for is quality over quantity. You do not need to have necessarily 100 partners as part of your collaborative. We really are looking at who are those core partners as part of your collaborative that are key and instrumental, have a specific role and responsibility to help you advance towards your systems change efforts. They should have a clear understanding of their role toward your systems change, and their letters of commitment should reflect on that. The second question, what is the history and structure of your collaborative, and why are the current partners well positioned to lead the systems change effort? Are there any key stakeholders, organizations not yet included who are critical for success? If so, why are they missing, and what is your plan to engage them? We get change happens within systems change efforts. Coalitions are evolving bodies. But we really hope that at this stage, your coalition is really built, your capacity is built so that you're ready to implement your systems change grant. There might be aspects over certainly the 3-year grant period or longer that you need to address specific technical assistance needs, but really all of your core partners at this moment should be aligned and necessary to help you achieve or make strong advancements towards your systems change. This is really important when you're thinking about, especially like the condition of the policy condition of systems change. If you're trying to tackle policy change at whether it's at any level, but you don't have folks that have experience in policy or know-how, or can influence or have impactful efforts towards that systems change, you might still need to build up your coalition a bit more. So that's the second question. The third question for the collaborative criteria, how is the community represented in this collaboration? How are those from the community addressing the change? And does the collaborative understand the community impacted by the work? Again, this is a bit of the health equity influence, ensuring those closest to the problem are closest to the solution. And we're taking not just a top-up approach to improving health. And then the fourth final question as part of the collaborative criteria, why is this collaborative ready to implement the systems change? Again, the timing of systems change efforts is really critical, and this question helps address that to ensure that you're really coordinated, planned, and ready to implement the work, and that it's done after a good amount of planning, research, and all of the partners are ready to see it through, to implement it. So that was the second criteria for the systems change grant. The third criteria is that the effort not only has to be framed as systems change, to be with a collaborative, it also has to be working to improve an element of a healthy community or elements of a healthy community. So these three questions are to be answered in your written application. The first one, what are the health outcomes you're hoping to achieve, and how do they connect to an element of a healthy community? I'll showcase the will in just a little bit so that you can begin to see that framing a bit more. Second question, how will the proposed systems change improve specific health outcomes? This is a really important aspect because you're beginning to take a deeper dive into the specific health outcomes that you're really hoping to achieve, especially using disaggregated data. So for instance, your collaborative effort might be trying to have systemic change to improve diabetes rates in Arizona. What we would really be looking for here is what are those populations and communities that have the greatest health disparity in diabetes rates in Arizona, and tackling that problem. And then the third final question is probably the elements of a healthy community outcomes criteria. How will progress in achieving the desired outcome be evaluated, and what metrics are used to gauge improved outcomes? We don't require formal evaluation as part of your grants, but you should have tracking measures to measure your success. What is your overall North Star when it comes to systems change, but also what are those incremental changes or small victories that are showcasing that your efforts are making improvements in health outcomes along the way. To help you better understand framing the healthy community, we are showcasing the wheel again. On the left-hand side, you'll see the traditional wheel that we've had for several years now. And if you elements community, where it'll take a deeper dive to say in transportation options, what does that all include? What are the specific work to translate the bill Spanish, which you see there reflected because we do want to be accessible to our partners whose work is primarily done in Spanish or bilingual. And then over the past several years, we've worked really closely with the Intertribal Council of Arizona, or ITCA, and tribes across the state to create elements of a healthy tribal community will to better reflect non-Westernized traditional tribal health components in community. So the WIL webpage also has an amazing interactive WIL that was developed by tribes here in Arizona that better reflects how they see elements of a healthy tribal community. I think that visual is just the coolest, and there are definitely art and culture, faith interpreted and interwoven within that will to better reflect again tribal community health. So if you're working in tribal health, that's a great framing for you to use as well. As I mentioned, Vitalyst Health Foundation is a health foundation, but we see health as more than just healthcare. A lot of the efforts that you're already seeing in the will are those non-medical factors. And that's because 80% of your individual health, our community health, are connected with non-medical factors. So those are efforts that you certainly can be addressing as part of your efforts. But if you're thinking, oh, I'm not working in diabetes or heart or whatever it is that are the more medical or disease-oriented health efforts, it's okay. We look at the broader social determinants of health, including socioeconomic factors, physical health, and then different health behaviors, not just healthcare. We're more than halfway through our grant criteria. So the fourth criteria of our systems change grant is health equity. So we want the efforts to be framed as systems change, to be done in collaboration, to improve health outcomes with a health equity lens. So the health equity criteria has 3 questions that you can narrate as part of your written application. The first question being, how will the proposed systems change reduce health disparities for the communities impacted by the work? This is, again, where you begin to look at the clear demonstration of how the proposed systems change would address the root causes of the greatest health disparities in Arizona. The second question, how does the health issue impact communities with health disparities? Please use data to describe the health disparities of those impacted by the work. Data is really key to improving health and your ability to track your progress and advancements and hopefully ultimate success towards your systems change. So how are you infusing data to showcase those health disparities and how your systems change efforts would address them? Especially when you're thinking about your work in this space using quality data, evidence, and research, and then the different barriers that are keeping that health disparity in place. The third and final question as part of the health equity criteria is, how have those most impacted by the health disparity been involved in developing the proposed systems change? Again, engaging those with community lived experience in the specific health outcome that you're hoping to achieve, getting their voice from the get-go, and ensuring that that important community-based research and data is activated through your systems change effort. This is another visual to show the difference between an equitable approach and equality, ensuring that you're really meeting the community where they're at to ensure your system change efforts are reflective of their actual needs. And the last, certainly not least, is the budget. So again, you are to reflect in your written application the narrative, the 5 questions for the budget. Again, another way for you to just provide a great story around what we are seeing in the budget spreadsheet template that you'll also submit as a measure of assessment for this budget criteria. So in that narrative, you answer these 5 questions to the best of your ability as reflected in the content underneath each question, and you will have a stronger application. The first question for the budget criteria, what are the projected costs for the systems change to be covered with the 3-year $175,000 grant? How is this also clarified in the budget worksheet? How do you intend on spending $175,000 over 3 years and ensuring that that aligns with the strategies, your proposed scope of work? Second question, what is the total anticipated project cost for the total system change effort, and what other sources are identified to help achieve the total effort? How is this also clarified in the budget worksheet? This is again to the point I made earlier that we understand systems change takes a lot of years, takes a lot of funding, even well beyond what our systems change grant and our total systems change grant program can offer. So we want to be able to see what you envision the anticipated total cost of your systems change efforts to not only perhaps help you fill that gap with other funding connections and whatnot, but to ensure that you're really thinking bigger picture about your systems change efforts, even beyond what the Vitalyst partnership may be able to leverage. The third question of the budget criteria, how does the budget help the collaborative project achieve or advance the systems change? Again, we want to ensure that the budget matches the proposed scope of work, is only allowable expenses, and is reasonable. We'll reflect on a little bit more about those allowable expenses in just a little bit. and that the funding will have a big impact in your effort. The fourth question of the budget criteria: how is the budget equitable to all partners and adequately compensates them all? This is a really big aspect of holding an equity lens in your budget. We allow for subgranting, subcontracting, and adequately compensating community members with lived experiences for their time and resources. So definitely value that within the budget as well. And then the fifth and final question to be answered for the budget criteria: what is the collaborative's overall budget capacity to lead the systems change effort? This is another assessment of the collaborative's capacity, structure, and ability to implement the systems change based on your financial capability. So a couple of allowable and not allowable expenses. We are pretty flexible with the budget, and as we have initial consultation calls through our discovery, we're happy to take a deeper dive into more specific questions you have around allowable and not allowable expenses. But we can allow, upon staff review, expenses for for-profit entities as part of your effort. This is most often seen by hiring a consultant or facilitator or external reviewer, perhaps an external evaluator that operates as a for-profit. We do allow direct or grassroots lobbying. Nonprofits can engage in this, but there are tracking measures that we have to do as a funder and that we want to ensure that our partners are aware of as well, but those are allowable. Not allowable are capital or long-term assets, things like buildings or equipment that would last, that are just to support the organization or the collaborative and not connected at all with the system change efforts. Things like if your system change effort requires tablets or something to help implement or execute the work of the system change, that is something that could be considered. And then we do not allow university indirect. So for those applicants that are from universities or colleges, and you're the lead applicant, you have to navigate with your institution how you can submit an application without having a specific line item for that indirect of required by universities. This has been done in the past, usually in coordination with your institutional foundation office or your sponsored projects office, but that is dependent upon you to explore and determine if you are the lead applicant as an institution of higher education. You will also not see any specific thresholds or requirements for administrative, personnel, fringe benefits, other more operational expenses, and that's intentional because we know systems change work is heavy work and takes strong human resource and capability. So you can reflect on that in the budget spreadsheet and the narrative, so long as it is reasonable and rational, not say 95% of your grant proposal. And we will reflect on that both in the review of the budget spreadsheets and in your narrative. So that's it, my friends. Those are the 5 criteria of the systems change grant for Vitalyst Health Foundation. Again, focus on systems change, the collaboratives working to implement that systems change to improve a specific element of a healthy community outcome while holding a health equity lens and having a budget both via narrative and spreadsheet that matches that proposed scope of work. So that was a very deep dive overview of the criteria. Now what? If you see great alignment with your effort and the systems change grant criteria, you can go through our discovery intake process if you have not already. And if you see there is alignment for systems change, go to the vitalysthealth.org partnering with Vitalyst webpage, begin your discovery intake form. It's a quick form that collects some basic information and should take you between maybe 8 to 12 minutes or so to complete. And if you are seeing alignment with the systems change grant, there's a drop-down menu where you'll select that. And then once we receive it and review it, you may be prompted to have an initial consultation with one of the Vitalyst team members. You do not have to go through the discovery intake process in order to apply for the systems change grant, but we highly encourage it because we can address any questions that you have during those calls and also work through if it is with core criteria, especially that systems change criteria. I highly encourage this, especially for those collaboratives that are working in those semi-explicit or implicit conditions. To understand and to define, and where we've seen the greatest challenge with our systems change grant proposals and our applicants defining them to the best of our ability. So highly however, online portal for the system change grant application opens today. Folks have until Thursday, October 9th at 5 p.m. Mountain Standard Time, Arizona, to submit your proposal. Not only the narrative for each of the criteria, but again, the letters of commitment as part of your collaborative criteria, and your budget spreadsheet as part of your budget criteria. The online portal is open, so if you have not yet created a profile in our new grants management system called the Koya Go, we just transitioned to this GMS, thanks in large part to the hard work of our colleague Michelle Goodthunder. So if you even have a previous grant partnership with Vitalyst, or are new to or have worked with Vitalyst in the past, we have a new grants management system, or GMS. So go to the online portal, create a profile if you're not listed there yet, and then you can begin to see the application and work on it. That's save the application with really cool setting. You can download the entire application in its entirety, but you've seen all the questions, again, open door policy, and navigate between each of the panes and go back if you need to make any edits. An important aspect of the online portal is there is no option to upload application. Has its own field within the online portal. So this is to ensure that each of the criteria and each of the questions within that criteria are answered by the applicant to the best of your ability. Each field does have its own character limit based on the scored weight. So for instance, the systems change criteria is 40 points out of 100. So that field is a lot bigger than the others that have a lower scoring weight. In total, however, the application should be around 4 to 5 pages if you're thinking about, and I highly recommend this, drafting it outside of the portal, saving the document, and then copy and pasting and transferring it field by field per each criteria and per each word limit. Throughout this process, if you have any questions about our grants program, especially around the online portal, have technical questions, just email grants@vitalysthealth.org, and our team will respond as quickly as possible. And finally, if you're thinking, not for this far ready to implement the systems change, that's okay. Actually want to have conversations with you. That's why we have set up our 3-tiered grants program, to provide more runway for folks to get to that phase of implementation readiness. You're thinking collaboration, then we will get you queued up for Spark, which is the 1-year grant of $25,000. The Spark grant and the technical assistance grants do have to go through our discovery process so that each staff can have that deeper conversation. And then if there is alignment, each director has the ability to invite you to submit an application. We're currently working on those materials, including an evaluation for both the Spark grant and the technical assistance grant to help clarify exactly those criteria. But the criteria for the Spark grant, the technical assistance grants are the same 5 criteria as a systems change grant. They're just different because you're at a different stage in your journey towards systems change. And then if you're thinking, we still need to do some work to build up the capacity of our collaborative, that's the technical assistance grants. These are grants of up to 1 year, up to $20,000, really depending on what your specific capacity building and technical assistance needs are for your collaborative. These are reviewed on an ongoing basis, again, have to go through discovery. And once the initial consultation call is had and it's discovered that, yes, you are aligned with the technical assistance grants, you'll then be invited by that director to apply for the technical assistance grants. But the deadline of approval, we have simply set up an internal review process with our team. So can review these throughout the year and based on our that's it. Thank you so much for hanging with us for about an hour, 20 or so minutes while we review. Are transcribing all of those questions and the answers, and also the questions that are asked through our live Q&A now. And we'll post those as part of a frequently asked questions document, in addition with these slides and the recording to our webpage, and we'll share them out with everyone who has registered. Michelle.
Yes. I flagged them and now I'm trying to find them again. Okay. How should we best demonstrate overall budget capacity?
A rural budget capacity?
No, best overall budget capacity, because one of the criteria is how to demonstrate your budget capacity. So how do they best do that?
Sure. Yeah, this one is, let me actually pull up the exact wording we have so I can use that. So you'll see in the budget criteria, the questions, they kind of think, okay, how does my collaborative intend on spending $175,000 for the grant? What is the total anticipated cost of the systems change? And then what is the overall capacity of our collaborative? So that last piece is really to better assess kind of what the collaborative's readiness and infrastructure to work towards systems change. And strong collaboratives that have built up their capacity should have outlined in some way a budget similar to a traditional nonprofit organizational budget, though there are certainly different aspects that vary. So for instance, a coalition may not have a building or office, right? You kind of rotate between everyone's rooms, or utilize Vitalyst conference room for your coalition meetings or whatnot. So it just differs. So to the best of your ability, I would reflect on those traditional nonprofit budget templates to be able to compile your collaborative's budget and reflect on your overall budget capacity to lead the systems change efforts. You can also use the budget template that we have for our systems change grant application, because that does reflect very traditional costs, but also some other allowable expenses that we would see as allowable for and necessary for collaboratives. I hope I answered your question.
The next question is, can you further explain expenses to for-profit entities? Can this include staff costs or only consulting?
It can include staff cost. If the staff cost is for a for-profit entity, that would be an allowable expense. But again, you have the great opportunity in the budget narrative as part of your written application to really elaborate on those expenses and ensuring that if it's a fee for service or contracted service like that, that it's working to advance your systems change and critical to your collaborative efforts. Any staff costs that is associated with your collaborative or those lead nonprofit entities might be better reflected as within like the staff category, staffing or administrative category of your budget spreadsheet.
Thank you, David. I am looking. The next question, do organizations ever apply for both Spark for new projects and full systems change?
This question comes up a lot and it is allowable. That's why we have the discovery consultation calls to really explore the different projects, the different system change efforts that the same collaborative or the same lead applicant might be working in a lot of different spaces. The big question then again turns back to that capacity of not only that lead applicant to help facilitate or kind of be a backbone organization for the collaborative. So really look at that capacity and readiness of the organization. But we have often seen this with larger institutions that have a lot of different arms, departments, or units to be able to have the capacity to tackle a lot of different collaborative efforts. If they are different systems change efforts, different systems change projects. Certainly, if it's the same project, we really work with you to see where you're at in your journey towards systems change.
Thanks, David. That is all the unanswered questions from the chat that I stumbled upon. So if anyone else has additional questions, you can put it in the chat or come off mute.
Wow, y'all must have rocked it in the Zoom room answering the questions. Awesome. Any other kind of top questions that you might remember that were addressed in the Zoom room that might be helpful to just kind of raise verbally here, Michelle? Or that people want to ensure that it's covered?
I'll look while people.
There was one about, can two different organizations apply for the same project? So two applications to apply for the same thing. And I think for us that answer would be no. And Michelle answered it already. But what we really want to see is groups and collaboratives really working together. So if you're both tackling the same issue, we want you to work together. And we want you to have conversations and say, who is it that we still need at the table? And if you two partners aren't working together, there's probably a reason you should come together to tackle that issue.
Great response. And there actually has been instances in the past where two separate organizations applied for the same systems change effort and had different approaches. And we did our best to try to encourage them to collaborate more because their application would be reviewed that much more strongly. And for a lot of different reasons, they just weren't able to come. So they did submit separate applications and both did not advance for funding. At the same time, we also promote other grant resource opportunities, including the Arizona Together for Impact Fund, which is a pooled fund with about 20 funders across the state of Arizona that supports specifically nonprofit collaborations, including mergers and acquisitions, shared support functions, and joint programming. But there might be some opportunities for you to receive grant funding to help facilitate those collaborative conversations.
And then
Thank
I
you for raising that, Sergio.
Yes, thank you. And on that note, we had a couple people ask, does the funding go to the lead applicant or to do the sub grants, or does it go to all partners? And I answered that traditionally it goes to the lead applicant to handle the finances, but upon request, we can issue funding to the partners directly.
Yes, we can do it, and it would be very, very rare that we have done that. We really do try to keep it to one check to the lead applicant, and then you all can reallocate, re-grant, subcontract as your budget clarifies. But we really do try to write one check to one lead applicant.
And then I think the only other thing I'd raise.
And I also want to clarify as part of that, Michelle,
Yeah.
the application is only coming from a lead applicant. So there's no co-submissions. It is a lead applicant that submits.
Correct. There's an opportunity for partners to contribute to an application with special permissions in our site. You just reach out to us at grants@vitalysthealth.org if that's something you're interested in, if you want someone else to write a portion of the grant or look it over before you actually submit the application. That is an option. And then another question I just want to raise is if we already had the discovery consultation, then what do we do? What's next after that?
Sure. I guess it would depend on how recent, but as I mentioned, we do have a new grants management system where we're really trying to shift over all of our new discovery calls and exploration of new projects, new grant opportunities. Your information might already be in our new system because we did do kind of a data transfer. But especially in a new grant cycle, as hopefully you've seen, we've improved a lot of our application materials, even have clarified some of those discovery intake questions so that we could just have more fruitful conversations. So I would say still consider the discovery process, highly encourage that. But again, the System Change Grant is an online application portal. So you're also welcome to simply submit your System Change Grant application by deadline.
And then this other question I really like, you kind of answered it, but it goes a little bit deeper. Is there a matchmaking networking process where organizations who are working towards similar change can meet and develop relationships for future coalition building? I'm asking specifically as someone who is new to AZ, but not the work of health equity.
Yeah, great question. And you might be better suited for the technical assistance grant, where we have had successful technical assistance grant partners utilize the funding to help navigate those that matchmaking, as you say, including perhaps utilizing the funds to hire a consultant to help facilitate those conversations and relationships, especially because that external consultant can be often seen as more of a neutral convener, which is an important aspect often of coalitions and collaborative building. So yes, that would probably be more aligned with the technical assistance grant. We also have a lot of great expertise with the Vitalyst staff members, even those that aren't on today's Zoom, that we often tap and say, do you know who's working in this space? And more often than not, we're happy to make those connections and help make those warm introductions.
Thank you. I have another question. I'm loving this. Could a successfully awarded project that is now successfully providing system change activities to the community apply to additional funding / grants to support, augment, or expand the project?
Could a successfully awarded project that is now successfully providing system change activities to the community apply to additional funding? If you mean additional Vitalyst funding or separate from Vitalyst. Okay, brilliant. Sean, thanks for that. You were reading my mind right there, Sean. I love it. Yes, absolutely. That's especially kind of that as we were reflecting on the budget criteria, we ask, okay, how are you using the Vitalyst grant of $175,000? What's the overall anticipated cost of your systems change efforts? And in the budget spreadsheet, you'll see where you can outline kind of who your other funders are, or even if they're committed, certainly, but also just requests that might be in, so that we could begin to see what is that funding gap and maybe help you fill that gap through our own funder connections. But yes, the intent is certainly, we understand as long term and as kind of streamlined, we have set up the Vitalyst Systems Change Grant in totality, a 5-year grant potential of up to $225,000, or even the 3-year grant of $175,000. That might only be a small aspect of the overall systems change budget needs. So yes, please continue to fundraise. Please continue to, especially if you're an existing Vitalyst grant partner, to turn to us if we can be helpful in any external grant applications you have. We just actually submitted a letter of support for one of our existing grant partners who are trying to get a larger grant to help complement the existing grant partnership that we have with them. So yes, absolutely. You're welcome.
That's all the questions in the chat.
Okay, well, it looks like it's gone pretty quiet in the Zoom room. I don't see any hands raised, but really appreciate your time for spending nearly 2 hours with us to review the systems change grant criteria, the logistical aspects of the application, and our discovery process to discover partnership with Vitalyst, whether it be the systems change grant, Spark grant, or technical assistance grant. As I noted at the beginning, this is being recorded. We are transcribing and collecting all of questions and answers from the Zoom room and through this live Q&A to update a frequently asked questions document. And we'll post that, the recording, and the slides that were presented to the vitalysthealth.org website. The online portal is now open. You will see you'll have the ability to create a profile if you do not have one yet and begin working on your applications that are due by Thursday, October 9th, 5 p.m. Mountain Standard Time. We look forward to having those discovery consultation calls with you and reviewing your grant applications if you decide to apply. Thank you so much for your time.